host, Dr Owolabi HY. I am happy to be here with you once again to one station online that talks about education, academics, learning, behavior, and rights of the child in terms of education and in terms of care. Please sit back and join me as I discuss with you today an important topic. Before I go to that topic, I want to remind you, if you are a teacher and you want a very good school that gives you nice but living wage, then reach out to Edu Consult. If you are a school and you want some of the best crop of teachers in the country and outside of the country, we can always fetch you very good teachers. Apart from this, if your school is suffering slow growth, retarded growth, or the growth is seemingly not as fast as you want it, or you want to train your teachers, then you can always give us a call. If you do have children with certain problems, you can always reach out to Edu Consult through this channel. Back to what we intend discussing today. I intend discussing one issue, and that issue is the issue of the child not able to learn. When the child is unable to learn, there is a name for it. When the child is unable to learn, there is a name for it. When the child finds it difficult to learn like the others, there is a name for it. When the child is unable to do what others around his age, around his peers are doing, there is something wrong. That difficulty, that inability to learn like the others can be one, learning difficulty. It can also be learning disability. So today I will be looking at learning difficulties, which, but at the same time, I am going to give you the solutions to the problem. Once again, I say please sit back. Ask others to join you. If you cannot ask others to join you, do me a favor. Please share this with others so they could join our YouTube channel, Educa TV. Learning difficulties. Learning difficulties has no relationship with spiritual problems, has no relationship with neurological problems, has no relationship with biological problems. It has problems with the child and the environment. When a child has learning difficulties, then as soon as you are able to remove what is posing the difficulty on the child starts learning again. So learning difficulty is not medical, not neurological, not psychiatric in nature, not mental. Sometimes it can be anatomical, it can also be environmental. What are those things that could cause learning difficulty? When a child is unable to learn like others, that is the meaning. But then what are those things that could cause a child not to learn, but that are not neurological? One, if a child is hungry, this child will probably not be able to learn. If this child desires a thing and you cannot give the child, the fact that the child is unable to get what he or she desires can always affect the learning of the child. Sometimes the child wants a particular food today, and because you have failed to give the child that food today, and there is no word of soothing, no word that will soothe the child, then the child goes to school with a mind of a parent who does not like him or her. If the child has medical problem, for instance, if a child has stomach problem, stomach ache, stomach worry, stomach turning, heart burning, irritation, these are issues that can cause learning difficulties. At some other time, if the child has headache, if the child has itching on the skin, while others are learning, if the child kept on scratching, the possibility of learning will be very, very low. Some other time, the child feels sleepy, and we say, oh no, you have to go to school today. If a child is feeling sleepy and the child is not allowed to sleep, then the child will lose concentration. At some other time, like I have said, if a child knows that the mother is high-handed, if you are a high-handed person, you have to beat your child for everything. Anytime the child thinks of going home, then the child is distracted because the child is going to meet a mother, a guardian, a sister who she thinks is wicked at home. Some other time, some of these learning difficulties can be posed on the children by the things we keep at home. We want the children to learn at home, but we have our TV set on. We have our player items on. We have our sound items on. We have our sound system playing at a very high decibel of sound. Some other times there are sounds around us that will not allow the children to concentrate. All of these are things that can cause a child to have learning difficulties. And when a child has this, all you need to do as a teacher, as a parent, as a guardian, as an expert is to identify the factors the factors leading to learning difficulties. And once you identify them, once you remove the problem, you see the child going back to learning. So I take an example. If a child has headache and I am able to provide food for the child, and I ask the child to take a relief tablet, pain relief tablet, and I say, okay, after about 10 minutes, the child is okay. Once the child is back in the class, the child is able to learn. So, in other words, for the purpose of this discussion, learning difficulties can come from things that we can remove. And once we remove it, the child gets back learning. I want to quickly stop here, and maybe in another few days we are going to schedule a live show when you are going to talk to me about learning difficulties. Tell me about some other ways that you understood could pose learning difficulties on the child. I am your remediator, the one who will tell you more about some of the things that could prevent your child from learning.